everybody.
Welcome to Lady Vibe.
Your podcast for better well-being.
This is your co-host, Dr. Ning.
And I'm your co-host, Rachel.
So today we have the honor to get Dr. Julie Harris into the studio. She is my long-term friend. We met in the very like distinguished field epi training program years ago, and I will let her introduce her diverse experience in global health later. But we got her into the studio to try to get in pre to get our audience familiar with the public health sector of healthcare, because public health really plays a key role in keeping us healthy. Um, and that goes back to another important aspect of epidemiology. Like we collect population level data, right? Like when you hear people talk about disease or complications, like a lot of times it's from their individual experience. Oh, I have a friend. Oh, I heard this case. But you have to really look at these things at a population level, whether something is safe or dangerous, or like a risk factor, like a factor that some people may say that, hey, my grandpa smoked all his life. He lived to 100 years old, and so smoking is fine. That's, but if you look at the population level, right, the smokers have, let's say, like, 3 times higher risk of getting cardiovascular disease. I'm just throwing out there, that's
Yeah,
not an accurate number.
yeah.
But right, you just really have to look at that population level. That's what epidemiologists do. Um, to
Yeah, and maybe just to underscore that, I think one thing that I learned a lot about overseas, or that I experienced, is that it's a much more, in many places, it's much more communal than it is in the US. And in the US, we feel like I should be able to do whatever I want, and I shouldn't have to be uncomfortable with anything. And that is not, honestly, that's not really the way public health works. You don't get vaccinated because you are likely to get measles. You get vaccinated because if nobody gets vaccinated, then everyone gets measles. And so, when people, I can understand people's discomfort, with putting something in their body. And I can absolutely understand, somebody saying, well, I don't know anyone who's had measles. Why should I get the measles vaccine? And I think we see what happens when we don't get the measles vaccine. Even, this past year, there have been something like 1,400 plus measles cases. There have been a couple deaths, and there are these long-term effects of measles too. So even if you survive the measles, it's not like, long COVID is the only long viral condition that you might have. You can also have sequelae from measles that are debilitating for your entire life. And so, I don't know how within our culture, how easy it is to convince people that you should get something for the good of the public. But that really is what public health is. And I think that's a real challenge for us here in the US.
That is so true. Like the culture plays a big role in public health. Like the life expectancy in China doubled during the first 30 years of the new country started. 90% or due to more than 90% or due to the improvement in public health measures, like get clean water, clean air, and then got rid of a lot of that source of, like zoonotic uh, diseases and parasitic diseases, because we clean up the environment and stuff. So,
It's true. Yeah.
mhm,
Yeah. And
yeah,
I think some of the biggest public health interventions, right, are just clean water, right? And systems, a way to wash your hands, and systems that take your poop away from you. Those three things are so, so important, because they would take care of, worms, like most or many parasitic diseases, diarrhea, rotavirus, cholera, a lot of the foodborne disease, just all of these things really can work together to keep people safer.
yeah, exactly. And then for those unfortunately, although we have done so much work in infectious disease prevention and control, right? The only thing that we can declare of eradication is smallpox. All other infectious diseases like polio, they're still going around in some parts in the world.
Yeah.
And if we don't do anything, don't get our vaccines, don't get our kids vaccinated, they're going to come back because viruses are, you're a virologist, Julie, you can probably testify to that. They are smarter than us. Like,
Yeah, I mean, they're basically machines, right? I mean, they're not even alive. A virus's only role, and I don't want to say its only interest because it doesn't have an interest, but it's like a little clone that just clones itself. And it takes advantage of your cells and the machinery you have in your cells. It gets in your cell, uses your machinery, and makes, millions and millions more of itself, and then it gets out and goes on to other cells and does the same thing. And so, yeah, I mean, viruses, I don't even want to say they're smarter than us, but just by virtue of the way they're made, they are made to replicate a lot, way faster than we ever would. And we're continually encroaching on animal habitat, right? We're exploring new places, and we're taking viruses that used to just live quietly in bats, like Marburg virus or Ebola viruses, or in other environmental niches, and we're suddenly becoming exposed to them. And so this is another reason I think that that viruses are coming out, and we're seeing more and more.
and
I'm
Julie,
curious for people who are, wanting to learn a bit more about sort of, the spread of disease and the process, especially, kids in high school or, kids maybe beginning college. What types of resources could they look at just to learn a little bit?
Yeah, I mean, honestly, kids today are way more technologically sophisticated than I am. And I see that, with the young folks at work, they just know so much more than I do about how to do pretty much everything. But, if you're interested in viruses, Vincent Racaniello, my former PhD advisor, runs a great podcast called This Week in Virology, and or TWIV, and he interviews loads of interesting people on that. But also, I mean, I feel like you could pretty much, Google your way through anything. We used to use books like Control of Communicable Diseases. I just gave away my CCD book because I was like, why would I ever use a book to find out information about this? I would just go to the CDC website or the WHO website. So I think, and there's certainly plenty of sort of disease genre TV shows out there. I think it's The Last of Us that is about cordyceps fungus. Cordyceps does not do to humans what it does to insects, but if I remember right, it's like a wasp, an ant bites a wasp, or a wasp eats an ant, or something like that. And then the fungus that's in the ant breaks through the wasp's head, and it basically turns it into a zombie wasp. And somebody made a TV show about that. So, there's really like what I would say, rather than going to any specific source, is if you're interested, like, just learn about it. The world is at people's fingertips now. Google it, go to a source that you trust. That is super important. Don't believe every single thing that you see on YouTube, because there is a lot of bad information out there. But things that you find on the CDC's website or on WHO's website, or like the Mayo Clinic or some respected facility, those are places where you can trust the information that you're getting, and you can learn a little bit more.
nowadays you can even use Chat GPT to summarize scientific literatures. You just give the keywords, and then
It's so true.
and I give you the source too, so you can see whether it was published in a reliable journal. So
Yeah, I do worry a little. I'll tell you, Ning, about ChatGPT and how reliable it will be consistently. Because I think at the moment, most of the information that is out there and that ChatGPT has access to is good. I do worry a little bit because there is a huge push towards misinformation. especially in the United States, but not limited to the US at all. In Uganda, there was loads of misinformation that went around on WhatsApp, and it spread fast, so fast, right? I mean,
Like
I really,
virus. This like
yeah, it
virus
spread.
spreading
I mean, it
across.
spread virally, right? And if you don't know what is true and what isn't true, it's really like, how can you know? I don't expect the public to know about viruses. I don't expect them to know about vaccines. I do expect that they can trust experts on it. And similarly, and I had just posted a Facebook post about this recently. Like, I don't know anything about nuclear power. And if somebody sent me information on it, I'd be like, no, that looks right. I wouldn't know if it was right or wrong. And so if I wanted info about nuclear power, I would go to a nuclear power expert to find out. And that's what people need to be doing about public health and about diseases that they're interested in, is to make sure that they are going to experts and not listening to somebody who, has an axe to grind or something about, some other reason. There's lots of reasons that people want to put information online. Some people just want to scare you. And that is, unfortunately, that's the world we live in.
That is so true. And that was the initial motivation of Rachel and I doing this podcast, because we just felt like there's just so much misinformation out there. And the bottom line of our show is to really get the expert on the show to talk about different
Yep.
health issues, and give the expert opinion on things. And I think we can also make an episode sometime later to talk about how to differentiate, uh, you know, fake information from true information. Like
Mhm.
when you are surfing on the internet, like you have to have the basic capability of differentiating those. Sometimes I get uh, misled by some people. They actually can make it look so real, but it's not. Even
Even
uh,
me, right? I mean, like, and to be honest, there are also like doctors and scientists who do spread misinformation. And so when you find something that sounds too crazy to be true, you should probably look at some other sources of information, right? And so double check, or triple check, and be aware that you can find anything you're looking for. If you want to find proof that pigs can fly, you can Google, can pigs fly? And somebody will have made a video saying, pigs fly. I know they fly. I grew up with pigs and I've seen them. They develop wings when they're about a year old. And they're going to tell you all these things, and they're going to use fake videos. And unless you go somewhere else, you're not going to know, right?
Yeah, 100%. One of the websites that I use is I use PubMed, which is a website where you can search different credible journal articles, and oftentimes you can even click through and get the whole article for free, and it'll give you the citation. So that's a good one. Another good one is some of these medical professional society journals are really great places to start. So those are just a few. I read PubMed, and then I go Journal of Vascular Surgery about every single day. So that's a good place to go, is PubMed, if you're not familiar with it.
Yeah, and the advantage to those is that they're peer reviewed, right? So if you have kind of one wacky person who wants to promote misinformation or an untrue theory, that gets balanced out in peer review. So that person sends their crazy paper to some people and they read it and they're like, this just doesn't seem probable, or we weren't able to replicate these results, or this isn't biologically consistent with what we know at the moment. And science changes, right? Like, as you learn more, what you have access to and the information you have access to changes. And so science, I think, can often be thought of as a best faith effort to understand things given the information that we have, that then gets updated if you get new information. That doesn't mean that science can't be trusted, but what you want to avoid is people intentionally spreading misinformation.
Yeah, I think
And
that's a
sometimes that can be costly, can cost your life for that. So many people, they were misled in their treatment, for cancer, for other type of diseases, and were dying earlier than they should. So Um, this is so true. So, Julie, I also want to know a little bit more about your, current role. I know you're doing a lot of training. You create training curriculum for field epidemiologists in both the U.S. and also for international countries. Um, so, you know, and you have been working on that for a number of years, right? Field epidemiology training. So, have you seen like much change in terms of, policy and like any trend in policy in public health uh, across the globe, like in the past 10 years?
Yeah, I really have. So there are things called the International Health Regulations 2005, and those are a series of regulations that countries signed on to that promote global, what we call global health security. Global health security, in the simplest terms, is keeping diseases where they start. So if you have an outbreak of a disease in country X, it doesn't leave country X, and even preferably, it doesn't leave the district or the state where it starts, right? That you're able to control it. And the things that are important in being able to control it are having a well trained public health workforce, having access to diagnostics, having political will and transparency to support it. And maybe this sounds simple or crazy to a lot of Americans, but there are plenty of countries that will have outbreaks that don't announce them. And so the international health regulations requires you to notify people when you have an outbreak of this disease, of a certain notifiable disease. And that can be, cholera, Ebola. It's not going to be like the common cold, right? Nobody's going to worry as much about the common cold, or I don't know, like maybe a gastrointestinal infection of some sort. But people do worry about things that threaten global health security, meaning that threaten other countries and other areas outside the areas where they start. And the best example of, a failed global health security is the 2013 to 2015 Ebola outbreak in West Africa, which started in Guinea and spread to countries in the region and then also to other countries around the world, although, minimally, but still outside of West Africa, it spread minimally, but it still did spread. And that is a challenge to global health security. So I work on creating materials for programs that train field epidemiologists to essentially promote global health security and to carry out global health security. So to detect an outbreak, to report an outbreak, to analyze data that can indicate when you have an outbreak, and then to respond to the outbreak in an effective way. So that is the bulk of my job, is designing materials and conducting trainings for epidemiologists all over the world to be able to keep diseases where they start.
That's so awesome. Is there an international outbreak registry database or reporting system?
So all notifiable diseases, and these are diseases in that special category of diseases, they do have to be reported to WHO. And if they fit certain criteria, WHO will call them a public health emergency of international concern, PHEIC. A small number of PHEICs have been, announced over the last couple of years, but Ebola is always, I think it's often, I don't know that it's always a PHEIC, but it always has to be notified to the World Health Organization. Sorry, my dog is back there walking around. And Mpox, which has really been spreading around the world over the last couple of years. Mpox was a public health emergency of international concern. So those you can find out about by going to the WHO website. There's not an international registry of all outbreaks that occur at any time. At any given time, there's a bunch of outbreaks happening in the US. There's a bunch that are happening in every country in the world. And whether or not, they get big enough to report is, that really governs whether or not you're going to hear about it.
Yeah, exactly. So, and then for the international health regulations, was that made by WHO or like some other agency?
Ooh, Ning, I don't know the whole history of IHR 2005. I know that, I mean, it was led by WHO, but I would guess that it's a collaborative effort of many countries around the world. but it predates my my entry into public health.
Question. So if there is an outbreak in a country that doesn't have the same level of communication as the US, i.e., multiple cell phones, what is the love to hear thoughts on sort of how you get the word out and what that process is?
So pretty much every country now has cell phones pretty much everywhere. They're not all smartphones, but somebody in every village is going to be able to find that information. But I think a better question might be about like risk communication, and maybe that's what you're asking about. Like if there's an outbreak in my very rural area, how am I going to learn about it? How am I going to learn about what I should and shouldn't do, who's at risk, when I should take somebody to the clinic, and how to protect myself and protect my loved ones. And that is very often, even now, carried out by radio and by a car with a loudspeaker on top. So the cars that go through villages with a loudspeaker on top, providing information, they just drive around for an hour or a half hour in each village, and they repeat all the information that you need to know, and then they go. But also, almost everyone has a radio, and a radio is a really good way to get information. Uh, or, a lot of villages will have one central bar or, central area that has a television, and everyone will gather for the television. There might be a chief. So working with community leaders like village chiefs and religious leaders who will then spread that information in the mosque or in the church, or wherever, people go for the religious services. There's lots of ways to get it out when you don't have the internet.
Yeah, in China, they have a very effective communication system, like from the top to the village level, like each level of government, like they have very effective communication. And for disease control this time in COVID-19 pandemic, like they really fully utilize the technology and GPS to do the case tracing and positioning. Like you don't even know you were exposed to some case, but after they identify the case, they can map out the whole trajectory, their whole like route of transportation, like, and then at what time point, if you were on the subway cart with that case, suspectable case, at what time,
Yeah.
like your bar will turn to red. Like you cannot go anywhere after that. So it was pretty like amazing. Like in the US, we're
Yes.
not to that level yet.
There was actually just an article in today's New York Times about how they do that in New York City and how closely you are tracked by surveillance cameras, by like metro swipes here and there. And it was fascinating. I am sure that most people in New York neither know nor are even aware of all the the surveillance that they are under. And like anything, when used for good, right, this is a good thing. And but all of these things can be taken over, and used in a negative way as well. So everything has a flip side for sure.
Yeah, absolutely. I know we're getting to the end, but maybe like Julie, you can share. Like, I bet you have investigated some great. You mentioned a couple outbreaks, Ebola outbreak, and some other outbreaks that you have investigated. But just in your years of working abroad, working with different health agencies, like, are there any other like absolute like jaw-dropping case that you encountered that you want to share with our audience?
I think one of the really interesting ones was actually in the U.S. When I was working in, I was working as an epidemiologist in the U.S., and there was a gentleman who worked with exotic animals. And one of the animals that he worked with was something called a kinkajou, which is this really cute, sort of like lemur-like animal. And he had two of them, and he was just an educator. He took these animals around to like schools and other places. And he had a pair of them. And one of them he had just gotten, and he reached into the cage to pick it up, and it bit him. And he put it back in the box, and he, continued to feed it, and it died a few days later. And then I want to say maybe 6 weeks later, 4 or 6 weeks later, uh, he had gotten bitten on the finger. He started to develop like sort of like a cellulitis, I don't know, even vasculitis maybe, where like the vein was like kind of showing up in his arm. And then his hand started to swell, and he was misdiagnosed and misdiagnosed and misdiagnosed because, nobody was really thinking about fungal infections. Everyone thinks about bacterial infections or viral infections. And it ended up that he had blastomycosis, which is a pretty rare fungal infection, and that he had gotten it from the kinkajou that was a pet. And luckily, he had taken the animal and taken its carcass and put it in a bag and in the freezer like the month before. And so we were able to actually test the kinkajou and find out that it did have blastomycosis, and it was the source of his infection. And he had put it in his freezer because he wanted to prepare the bones to use them for educational purposes. So he survived, but he got very sick. And I just thought that was one of the more interesting outbreaks that I've worked on.
That's so awesome. You never know where the danger
You
is.
never know.
And
You really don't. That's what makes epidemiology so interesting, is you never know what's going to come across your plate.
I feel like we need to have a picture of a kinkajou now for the audience. So
They're very cute. They're very cute. Yeah. As someone who loves animals, that story made me a little sad, but but happily the man survived.
yeah, and there's always a risk when you handle or get exposed to wild animals, even the
That's
birds
right.
flying in the night, right? If you get, you have to watch out for rabies.
Yep.
Yep. So always
Exactly
be
right.
cautious than not, than sorry.
Yeah.
Yeah.
Correct.
And then last, like for, the young kids out there who want to pursue a career in public health, in epidemiology, do you have
Hmm.
any advice for them?
Yeah, I do. And I think right now is a particularly tough time for public health. And like these days, public health graduates are having trouble finding jobs, and it's just not the greatest climate. That said, this isn't going to last forever. And we will, I think, come to some middle point on public health, and it will still be a needed career. And so I would say if it's something that interests you, pursue it. There really is no substitute for doing what you love. And I love public health. I love my job. I feel so lucky to have had it. And yeah, I mean, I would just encourage people to follow their heart with that.
Thank you so much, Julie. Follow your heart is the most important. If you want to make a difference at population level and protect people's health in big scale,
Hmm.
public health,
Yeah.
join the force. Yeah,
yeah, I love hearing your story about all your travels and all your adventures. It's like, to be honest, after I talk to you, I'm like, I cannot wait to go on a trip. So thank you for sharing with us your story and your journey. And I think you're going to get a lot of people really excited about looking into epidemiology. I mean, I've learned more in this hour than I probably have in a long time. So I appreciate it.
Well,
yeah.
thank you
Thank
so
you.
much, Ning and Rachel. It's an honor to be on here. I really appreciate being asked.
Yeah, thank you so much for your time, Julie. And let's stay in touch. We may get you back to the studio later.
Wonderful. I would love that.
Yeah.
Thanks.
Have a great day, everybody. Thank you for tuning in.
Have a great Lady Vibe day.
Bye bye.